Opsumit, Macitentan uses, mechanism and key information. What is Opsumit Macitentan? Opsumit, also known by its generic name Macitentan, is a prescription medication used to treat pulmonary arterial hypertension, PAH, a serious condition characterized by high blood pressure in the arteries of the lungs. This increased pressure makes it harder for the heart to pump blood efficiently through the lungs. Opsumit Macitentan can be prescribed alone or in combination with other PAH treatments. Clinical studies have shown that Opsumit helps reduce the risk of disease progression and hospitalization related to PAH. However, like any medication, it can also cause side effects such as headache, sore throat, nasal congestion, and anemia. What is Opsumit Macitentan used for? Opsumit Macitentan is specifically approved for the treatment of pulmonary arterial hypertension, PAH, in adults. It is designed to improve the ability to exercise, slow disease progression, and enhance quality of life for people living with this chronic lung condition. How Opsumit Macitentan works. Opsumit Macitentan belongs to a class of medications called endothelin receptor antagonists, ERAs. Endothelin is a naturally occurring substance in the body that causes blood vessels to tighten and narrow. In people with PAH, this process becomes overactive, leading to dangerously high pressure in the lungs. By blocking the effects of endothelin, Opsumit Macitentan helps relax and widen the blood vessels that connect the heart and lungs. This allows blood to flow more easily, reduces the workload on the heart, and helps the lungs deliver oxygen more efficiently throughout the body. As a result, patients often experience improvements in breathing, stamina, and overall heart-lung function. Side effects of Opsumit Macitentan. Like all prescription medications, Opsumit Macitentan can cause side effects. Some are mild and may improve as your body adjusts to the treatment, while others require immediate medical attention. It's important to monitor your symptoms closely and talk to your healthcare provider if you experience any unusual or persistent effects. Common side effects of Opsumit Macitentan. These side effects are among the most frequently reported and may lessen over time. Cold-like symptoms or sore throat, approximately 20%. Headache, about 14%. Anemia, low red blood cell count, around 13%. Bronchitis. Inflammation of the airways, about 12%. Urinary tract infection, UTI, around 9%. Flu-like symptoms, approximately 6%. Other mild side effects that may occur include nasal congestion, body swelling, especially in the arms, ankles, or feet, and low blood pressure. If these symptoms persist or become bothersome, inform your healthcare provider. They can adjust your treatment plan or suggest ways to relieve discomfort. Serious side effects of Opsumit Macitentan. Although less common, certain side effects can be serious and require immediate medical attention. Contact your healthcare provider right away if you experience any of the following: liver problems, swelling in the abdomen, yellowing of the skin or eyes, jaundice, confusion or dark-colored urine, fluid buildup, edema, shortness of breath, irregular heartbeat, swelling in the legs or feet, chest pain, unusual fatigue or sudden weight gain. These symptoms may indicate liver injury or heart-related complications and should not be ignored. Typical dosage of Opsumit Macitentan. The usual recommended dose of Opsumit Macitentan for adults is 10 mg taken by mouth once daily. It can be taken with or without food, preferably at the same time each day to maintain consistent levels in your body. Contraindications. When you should not take Opsumit Macitentan. Certain health conditions make Opsumit Macitentan unsafe to use. Always inform your healthcare provider about your medical history before starting this medication. Do not take Opsumit Macitentan if you are pregnant or planning to become pregnant. This medication can harm an unborn baby and is strictly contraindicated during pregnancy. Women who can become pregnant must use effective birth control while taking Opsumit Macitentan, and for at least 1 month after the last dose. Monthly pregnancy tests are required throughout treatment. If you become pregnant while taking Opsumit Macitentan, contact your healthcare provider immediately. Pharmacist tips for Opsumit, Macitentan. Keep all medical appointments. Your healthcare provider will monitor your liver function and blood cell counts regularly to ensure the medication remains safe and effective. Take Opsumit, Macitentan, consistently. You can take it with or without food, but try to take it at the same time every day for best results. Swallow tablets whole. Do not split, crush, or chew Opsumit, Macitentan tablets. If swallowing is difficult, talk to your provider about alternatives. Watch for fluid retention. Opsumit, Macitentan, can cause your body to retain fluid, leading to swelling in the ankles, feet, or legs, shortness of breath, or sudden weight gain. Contact your provider if you notice these symptoms. Be cautious about drug interactions. Opsumit, Macitentan, may interact with many other medications, including amiodarone, Pacer-1, diltiazem, cardizem, and fluconazole, diflucan. Tell your provider about all medications, supplements, and herbal products you are taking to avoid harmful interactions. Fertility considerations for men. Opsumit, Macitentan, may lower sperm count in men. If you plan to have children, discuss this with your provider before starting treatment to explore alternative options. Opsumit, Macitentan, is an effective long-term treatment option for pulmonary arterial hypertension, PAH, but it requires careful monitoring and adherence to medical guidance. Always follow your healthcare provider's instructions and report any concerning symptoms promptly. Subscribe to HeInfo for more expert insights and science-backed explanations about medications, health conditions, and safe treatment practices. Your health matters. Stay informed, stay healthy.